In this sequence, we are going to look at lower back movement and pelvic movement, particularly how the ball of the femur moves, slides and glides in the pelvic half. So go ahead and come down onto the mat. Take your time. Let yourself come down nice and slowly. We're going to start off with a little bit of breathing work here. So we're going to take your hands onto the sides of that ribcage. And then inhale into your hands right and left. So expand the ribcage wide. And then exhale, and feel those ribs draw in, the hands come towards each other. Inhale, ribs out. Exhale, ribs in. And down. Inhale, ribs wide. Exhale through the nose. Ribs sliding down. One more. And out. Go ahead and let the arms release down by your side. Now I want you to stand into your feet and almost try to push the mat really long with your toes. Allow your feet to slide the mat away from you if you can. And then pull the mat towards you. Push the mat away. Pull the mat to you. And use that push and pull of the foot to start to move the pelvis. So when we talk about proximal to distal, distal to proximal control, we want to see, can we recreate as much as possible for your nervous system what's going to happen in your life. So we're using the feet to interact with the pelvis, with the spine, with the rib cage, and with the head. Let's do one more. And then let it settle. And then we're going to start to rock the pelvis without the same pressure through the foot. So just allow the pelvis forwards and backwards. It's going to move the head. It's going to move the ribs. You'll still get a little bit of that push and pull through your feet, so not as extreme. One more. And then let your pelvis settle in the middle. And then this time we're going to start to drop your right thigh bone into your socket. Reach your left knee a little further towards the ceiling. And then swap. So one thigh bone drops, one thigh bone reaches, other thigh bone drops, other thigh bone reaches. So we're going side to side, right pelvic half to left pelvic half, just shifting that weight. Good. Pressing into the foot of the reaching knee. Let's go. 4, 3, 2, and 1. And then start to circle the pelvis around, as if you're trying to hit every number on a clock face. We go 4 and 3 and 2 more, and then go ahead and reverse. So same opposite direction, and get a sense of the thigh bone just dropping back against gravity, and that pelvic half swiveling around the ball of that femur. And then let it release. We're going to send the right foot down into the floor, left leg comes to tabletop. And then replace that foot, same leg again, up, and notice the ribs dropping back here. Focusing on that slide of the femur. Let's do one more. Reach, and down, other leg, spring, return, spring, return. Let's go for 4 and down for 3. Last 2. Once more and stay. Keeping that pelvis just dropping backwards. You're not pushing into the mat, you're creating zero tension around those lower abdominals. We're going to start to take one leg up into tabletop without anything really changing here, except your low back starting to feel a little heavier. Both legs come up. We're going to send one foot down and then spring it off the mat. So it's like we're jumping the foot, a little trampoline action. Good, reach, building strength into the arch, into those deep foot muscles. And reach, let's go 8 and 7 and 6 and 5, go 4 and 3 and 2. Last one, back up. Go ahead, from here now, we're going to keep the knees together, ankles together. Start to draw a circle with both knees on the ceiling, rolling around that pelvis. Easy, soft. Allow a little oscillation, a little turn in the torso. And then reverse it. And think of it as a pelvis mobilization more than a core exercise. Last two. Last one and steady. We're going to lower the feet back down to the mat. Keep everything together. Standing gently into one foot. We're going to allow the other knee to fall out to the side. Inseam of that leg getting long, groin reaching long. And then we roll it back in. Let's go same leg. We roll the ball of the femur, spiral the thigh back in. One more. Easy reach. And then take it back. Opposite leg, roll it away. Inseam of the leg, lengthens and releases. Outside of the leg allows it to go. Once more. And return. We're going to slide out. Slide the leg the length of the mat. Take it parallel and come in same leg. So we roll it out. Reach along the baby toe. Roll it back and in. So we externally rotate, back to neutral, and in. Last one, out, and slide, return, and in. Other leg, out, and slide, return, and in. Good. Just notice that shift. Looking for a slide. If it doesn't matter how close to the floor that knee gets. Let's do 3, and back, and 2. Slide and reach. One more. And in. Can we take both together? Let it settle and then roll it back. And you're not really looking for a stretch. You might experience a sensation of stretching in the tissues. We want to see more than pushing into the muscle and being really passive and dropping into end range for that joint. Can you get a sense of the thigh bone spiraling around? And then spiraling back in. One more. Good. Stay here. Just breathe with it. Send both legs away without allowing it to take the pelvis back in and return. Spiral out and reach out. Lower ribs. Stay melting into the fabric of your abdominals. And reach, turn, and home. 3 and reach, return, and in. 2 and slide, return. Freeing up that hip. Last one. And back. Standing the feet nice and tight in towards your seat bones. Heavy arms. And when you're ready, start to reach the knees over the toes. Let it to pick the pelvis up into bridge. And then dropping through the body, keep reaching the knees forwards to release back down into the spine. Stand the feet through the floor, feel the pelvis hover, then keep reaching the knees. As we come up, your sacrum at the back of your body is traveling through towards your pubic bone. Front of the hips open, back of the hips close. And then we release it back down, melt through. Send the legs away from you, let the hamstrings release. Let the front hips experience openness here. Arms reach overhead and just breathe. We're going to reach everything longer on the right side. Reach everything longer on the left. One more. Reach the right. Reach the left. Take it back to center. Bend the legs and release the arms. Okay. I'm going to take the arms and cross them over the chest to allow a little bit more weight to keep that rib cage melting downwards. So we're going to send the feet through the floor, hover the pelvis, reach the knees, and then nice and gentle release the spine. Elbows going towards the thighs. Elbows to thighs, ribs dropping back, and then nice and slowly releasing it down. Good. Pressing the feet through the floor. Back of the pelvis gets narrow, front of the hips open and spread. Spiral the thighs. And then back of the pelvis widens, seat bones widen like you're coming down into a squat. Do that one more time. Reach the knees. And then releasing it down, melting through the body. Last little bit of work here, arms reaching. We're gonna pick the arms up, reach the knees, everything reaching in the opposite direction. Now use the arms to invite the ribs all the way to the floor. Press through the feet, reach and open, creating space here in the front of the hips and through that front of the armpit all the way down, letting the back of the body carry you. And then arms roll the ribs forwards and back down. We're going to go for 4. And releasing, thinking movement and sliding in the joints, reaching the knees away. And ribs reading down. 2 more. Reach. And return. Last one. Stay up here, just the arms. Press for 10. Overhead. Exhale 9. And inhale. Exhale 8. This is a breathing exercise. Exhale 7. Keep pressing through the feet as you press through the arms. We reach and up. Let's go for 4. Release. Press for 3. Press for 2. Keep lifting the tail. Press for 1. And reach, then arms roll the spine down. And return. Go ahead and draw the knees into the chest. Just a little pull and release. Little pull. Last one. And relax.